Hello class, this lecture is on anti-inflammatory medications. Anti-inflammatory medications are given to reduce the inflammation, as the word says, anti-inflammatory medications. So let's look at the PowerPoint and see certain immune responses, certain cycles, and how these medications are able to work on breaking those cycles and reduce the inflammatory responses. All right, so let's look at our PowerPoint. All right, so this is anti-inflammatory drugs. Now our body has many defense systems in the place to keep it intact and to protect it from external stressors. So stressors include bacteria, viruses, other foreign pathogens or non-cell cells, trauma, exposure to extremes of environmental conditions. Skin protects internal tissues and organs of the body, considered the first line of defense, and skin sheds daily, preventing colonization of bacteria. What does it mean? The skin is a defense area where it protects any organisms to come inside our body. The glands of the skin secretes chemicals that destroy and repel many pathogens. So there's something called as normal body flora that will fight with any other anything which is like not good for the body. And so that is a protective area of not allowing anything which will cause harm to come inside the body. Any breaks in the skin puts the patients to risk of infections, wounds, burns, and rashes are the example of that. So basically, skin is the first line of defense. Second is mucous membranes, line of area of the body that are exposed to external influences but do not have skin protection. Areas include respiratory tract, GI tract, and GU tract. So certain mucous membranes have, they would protect us from invading bacteria and infections. Gastric acid, now, how there's times when our kitchen drains are blocked and then we'll put like bleach to it. So it's like gastric acid. That acidic environment kills any pathogens or anything, any bacteria, viruses, infections that are not good for the body. So that's a barrier, and that's also a body's defense. Major histocompatibility complex. What is that? That is distinguishing between self cells and foreign cells and considered the body's best barrier for defense. The genetic identification code carried on a chromosome produces several proteins or antigens that allows the body to recognize the cells as being self cells. Anything that is not identified as a part of individual genetic code is considered foreign and is usually marked for destruction. So, primary body defenses or cellular defenses we know is composed of, what is it composed of? Leukocytes, lymphocytes, lymphocytic tissue, lymphoid tissue, and numerous chemical mediators. So these are just like your WBCs, your white blood cells come under leukocytes, and they're like fighter cells. So you know how when we go for a war, there's always a fight, and then there's two sides. So just our body will fight any kind of foreign bacteria or viruses, and it will help our body to overcome by regularly those are called our body's defense mechanisms or defenses that are protecting us from foreign invasions. So cellular defenses, then there's cellular defenses. There's two types of WBCs that are made by bone marrow stem cells. Now lymphocytes, the key components of immune system, consist of T cells, B cells, and natural killer cells. Myelocytes develop into several different cell types that are important in both basic inflammatory responses and immune responses. They include neutrophils, basophils, eosinophils, and monocytes. Now, if you see on this picture, this is bone marrow. Bone marrow is the one that produces our RBC, WBC, platelets, and all kinds of blood cells. So those are the three major ones. Now WBCs are the ones that are fighter cells in our body, right? WBC or white blood cells. Now bone marrow produces it. Now they come under lymphocytic cells or myelocytic cells. Now lymphocytic cells are natural killer cells, or it could be B cells that are plasma cells, and they produces antibodies. They also memorize any kind of infection that was fought before, and that is B cells. T cells. T cells are cytotoxic T cells, helper T cells, suppressor T cells. So some T cells will be fighting. Some of them are like CD4 T cells, and they will be fighting infection. Then suppressor T cells will suppress the T cells not to fight, as so they are the balancers. Basically, they will balance if there's enough of response to fight those cells, and these suppressor cells will be like, okay, we're good, we actually won our battle, so cool off. So that's suppressor T cells. Okay. Myelocyte cells are neutrophils, eosinophils, basophils, and monocytes and macrophages. So what are these? These are just different kinds of WBCs that are part of myelocytic cells, and they're produced by bone marrow. Okay. Now, what are each action of neutrophils? What are neutrophils? They are just one kind of WBCs, white blood cells. What do? They're capable of moving outside the bloodstream and engulfing, digesting foreign materials, which is called phagocytosis. Phagocytosis, think about big fishes eating the small fishes. So that is phagocytosis, like they engulf them, like they eat them. So that is phagocytosis. Basophils are not capable of phagocytosis. The purpose is to initiate and maintain an immune and inflammatory response. Eosinophils function is not understood, but they are for allergic responses. So if there's allergy, then eosinophils come out and try to reduce the responses. They're responsible for removing the proteins and active components of immune reactions from the site. So eosinophils, so let's say there was someone had gone into poison ivy. They touched the poison ivy, and then it caused allergic response. What are the cells fighting against it? Will be eosinophils. So eosinophils are for allergy responses. Okay. Monocytes are macrophages. Again, what is phagocytosis? Eating a small cell. So they will just eat them up, and they will engulf them, and then they will destroy them. Remove the foreign materials such as pathogens, debris from dead cells, necrotic tissues from injury sites to the body. So they're eating those foreign materials or foreign pathogens. Macrophages also releases chemicals that are necessary to elicit a strong inflammatory reaction. Next is lymphoid tissue. What is lymphoid tissue? Lymph nodes, spleen, thymus gland, and bone marrow. They play an important role in cellular defense system. Bone marrow and thymus glands help create the lymphocytes and myelocytes needed for cellular defense. Lymph nodes and lymph tissue store concentrated populations of myelocytes in areas of body that facilitate their surveillance and destruction of foreign matter. Inflammatory response. So let's say there was an invasion, so someone got infected, right? There was some infection that comes in the body, so our body will activate something called as Hagman factor. And this Hagman factor himself will activate three systems: kinin, clotting cascades, and plasminogen system. So these three systems, this Hagman factor will activate three systems, and these three systems are basically causing inflammatory responses, which helps in fighting infections. So kinin system is the first system. Kinin system is bradykinin is one of the kinins that will cause local vasodilation and changes in the capillary permeability. So it will cause the vessels to dilate, and then all the blood flows to that area. So let's say someone got a cut, and then the cut, there's inflammation and swelling after a little while, right? After you get a cut. So what happens is the blood vessels, they open up, and that's called vasodilation, and all the capillary permeability opens up because it will bring all that WBCs to that area, and that will stimulate the nerve endings and alert the body to basically tell the body, hey, you know what, we have this area injured and we need to bring all those WBCs and vasodilation to this area. So that is kinin system. Now this one it talks about tissue injury whenever, let's say, there was a cut in the hand. So there will be histamine release. Histamine release is the one that causes allergic responses. It will cause increased capillary permeability, vasodilation. Then it will cause the exudation of plasma proteins, edema. It will cause swelling over there. It will cause rubor redness, and it will cause calor, blood flow, vasodilation. And then also for tissue injury, it will cause exposure to injury. So also like there's another system which is activated by Hagman factor. So it will activate kinin system. Remember, it will activate kinins, and kinins will activate bradykinin. And then bradykinin itself will activate leukotrienes, prostaglandins. What do? They will cause more of excessive amount of pain, and then it will cause all activation of all the neutrophils, the leukocytes to come on that side. Phagocytosis, they're going to start eating all that foreign material over there, and then it will remove the debris by eating all that foreign material. So that's the way body deals with any kind of tissue injuries. So this is like, think about like someone having a cut in let's say there was a paper cut in the finger, and then we know that there will be histamine. Histamine is first, the two things that happen is release of histamine. Histamine will cause swelling, rubbering, and how does that happen? Cause vasodilation, capillary permeability. Another part is that our body responses will activate Hagman factor, and that will cause the cytokinins. And cytokinin releases will activate prostaglandins and then leukotrienes in the system, and causing all of that release. So this is why do we need to learn this? Because there are certain medications such as Benadryl that are antihistamine medications that will reduce the inflammatory responses. They act on histamine. Some medications such as some are prostaglandin inhibitors. They will inhibit this area and they will reduce the pain, prostaglandin inhibitors. Some are leukotriene inhibitors, and some will act over here and will not allow as much of inflammatory responses. So all of them are reducing the inflammation by cutting the cycles, like reducing, maybe one medication will act over here, one medication will act over here on prostaglandins, and one medication will act over here. So that's how they all work. Histamine release. A locally mediated response causes vasodilation, stimulate pain perception. It brings neutrophils to the injured area to engulf and get rid of invaders to remove the cells that have been injured. Chemotaxis. What is chemotaxis? Attracts neutrophils, macrophages to become very aggressive. Lysosomal enzymes break down in one's living tissues after death. So causes local cellular breakdown, further inflammation, and could cause vicious cycles leading to cellular death. Now, rheumatoid arthritis and systemic lupus erythematosus are examples of uncontrolled cycles. So prostaglandins and leukotrienes are important to inflammatory responses because they act to moderate chemotaxis in order to prevent this destructive cycle that is happening on a regular basis. So, and then many drugs used to affect the inflammatory and immune responses modify and interfere with these types of inflammatory reactions. So rheumatoid arthritis and systemic lupus erythematosus are actually autoimmune responses. Autoimmune responses is when our body starts to fight its own self. Instead of fighting other things like, oh, this is the foreign. No, you're fighting yourself. That's not good. So that is autoimmune responses. So certain autoimmune responses is like there was a virus and then it got close with one of the cells, and then the body is recognizing its own cells as virus instead of actual virus, and is causing its own destruction. So those are autoimmune processes. Now, any inflammatory response, so let's say there was inflammation, what does it have? It will have heat, which is called calor. It will have swelling. It's usually, think about a paper cut in the hand. So it's like, oh, there's like a little bit hot, it becomes a little hot, it becomes swollen, it becomes red, and then there's pain at the site. Well, that's just a part of inflammatory process, and we see all those things. Why redness happen? Because of vasodilation, all the blood goes there. Swelling happens because there's like a lot of fluid underneath the tissue, and then pain because all of that, we just have seen in our our prostaglandins that causes severe pain. So immune responses, what are immune responses? Anything fighting against infection is immune response, right? So some people say, oh, I want to boost my immunity. What should I eat? So some people say, oh, eat garlic or turmeric, or some of those could be very helpful to increase the immune system, because immune system is the one that fights infection. So if your immunity is strong, so people say, oh, reduce your amount of stress, go for exercise, walk every day, listen to music, hang out with your friends. Why? Because they are all immune boosters. All of them help you to boost your immunity. So it's a good thing to de-stress yourself by talking to your best friends, telling them your challenges, or just go for 30 minutes, 1 hour walk. Have a pet, play with your dog or your cat or kitty cat. All of those are what it does is it reduces the amount of your mental stress, which will by itself will improve your immune responses to any infections or anything in your body. So immune responses. Let's go back to the slide. So some immune responses, some specific invasions can stimulate more specific responses through immune system. So lymphocytes produced in the bone marrow can develop into T lymphocytes or B lymphocytes. Their identified lymphocytes include natural killer cells and lymphokinin activated killer cells. These cells are aggressive against neoplastic and cancer cells and promote rapid cellular death. Okay, types and function of T cells. Now T cells could be 3 types. There are cytotoxic T cells, helper T cells, and suppressor T cells. So T cells, what is the function of them? They are found throughout the body and destroys the pathogen by punching holes in the cellular membranes and secreting cytokines. So they will just cause those chemicals to come out aggressive against non-self cells, and they can directly destroy foreign cells and mark cells for aggressive destruction by phagocytosis. What is phagocytosis? Eating the other cells. Like they just cause those, let's say your drain was blocked, you would just put like chemicals in it, like you put bleach in it, and it causes that drain to open. So that's what, producing all those chemicals will cause that, fighting those pathogens. And then at the end, eating them is phagocytosis. So that's a function of cytotoxic T cells. Next one is helper T cells. They stimulate the activity of B cells and effector T cells to become more aggressive and more responsive. So they're like the ones that are like, yes, let's go, fight. So they're the ones that are helping the T cells to be more strong, more fight against those infections. Now suppressor T cells, on the other hand, they're like, okay, we've done enough fighting, you need to slow down. So monitor the chemical activity of the body and helps to slow and suppress the immune response. So enough of fighting, okay, let's cool down because we're good, we don't need to fight anymore. So that is suppressor T cells. It acts to suppress B cells and T cells activity, and then foreign antigen is under control. This slowing action allows the body to conserve energy, keep it from having continuous inflammatory reactions, which is not good. So technically suppressors are the ones that are like, okay, slow down you guys, we're good, we fought the battle, we won, okay, cool off. So that's suppressors T cells. Role of B cells. A role of B cells is programmed to identify specific proteins or antigens involved in humoral immunity and produce antibodies and immunoglobulins, which circulates in the body and react with specific antigens when it is encountered. So B cells are another type of cells. They come under humoral immunity. Complement proteins. So antibody formation. So what is antibodies? Antigen, antibodies. So you probably have heard, oh, I don't have enough antibody, I need to have some antibodies. Or what are antibodies? These are basically the ones that fight against antigens. Antigens are anything, let's say, which your body has produced. Antigen was something that was coming from outside, and then antibody is something that's fighting from your body against it. So reaction in the cascade fashion is to form a ring around antigen-antibody complex, and the complement can destroy the antigen by altering the membranes allowing an osmotic inflow of the fluid that causes the cell to burst. The antibodies are, so what are different kinds of antibodies? IgM, IgG, IgA, IgE, IgD. So IgM antibody is for first exposure of any kind of infection this is produced, and that is IgM. Now IgG is more for memory cells from previous infections. So if we see an IgG antibody in the system, we know that the infection was previous. IgA is an antibody that is found in tears, body fluids, saliva, sweat, mucus, and bile. These antibodies react with pathogen encounters exposed area of the body. And IgE, what is IgE? It is related to allergic responses. So if someone says, oh, which antibody helps in allergic responses, you're going to say IgE is the antibody that helps in allergic responses. And IgD, its role has not been identified, so we just don't know, but it exists. Okay, so IgM, remember this one is the first, like whenever there's like active infection, something in your body's fighting against it, that's IgM. IgG, it was already there, the battle was fought, we're good, it was just present from old, it's like a memory. IgA, something that is always present in the body fluids. Those are, and so IgA antibodies are, let's say if a mother is feeding a baby, then it goes from the mother to the baby. Okay, next, the other mediators in the immune responses. There's other chemicals, one is interferon. It prevents the viral replication and suppresses the malignant cell replication and tissue growth. Interleukins, chemicals secreted by active leukocytes to influence other leukocytes to help stimulate an immune response, and causes fever, arthralgia, myalgia, slow wave sleep induction, all things that help the body conserve the energy for use in fighting off invaders. So interleukins is another chemical. Tumor necrosis factor, chemical released by macrophages inhibiting tumor growth and cause tumor regression. So these are all just other fancy name for different chemicals that does their function in immune responses. Interrelationship of immune and inflammatory responses. Immune and inflammatory responses work together to protect the body and maintain a level of homeostasis. So they're like, they basically fight, and then they also like find like a balance. Okay, if your body's stronger and fought against it and you win, then it is pretty much more like, okay, let's cool off, we won at the end. So that's pretty much like there's a balance of like, we don't need to fight anymore. So effector T cells, so both B cells and T cells depends on effective immune inflammatory reaction to achieve the end goal of destruction of the foreign protein or cell. Okay, so this is just from your book, chapter 16. You can review it by yourself, but I'm going to go over the drug medication part. So anti-inflammatory drugs, now what are those? So as we talked about, remember that cycle, some medications will work on antihistamine, some will be on prostaglandins, and some would be on interleukins. So that's basically their function. So many anti-inflammatory drugs are available over the counter and have potential for abuse and overdosing, such as Benadryl. We don't want to overdo them, so we need to know more side effects and nursing management related with it. So patients may combine these medications and unknowingly induce toxicity, such as if someone's taking Tylenol, we tell them, hey, you know what, you don't take more than 4 grams a day because it could cause liver problems. So we only take it so much, not more than what is required, because they could be toxic. All of these types of drugs have adverse effects that can be dangerous, and if toxic levels of the drug circulate in the body. So that's why we want to make sure that we don't overdo them. And then African Americans have documented decreased sensitivity to pain relievers effects. So different races have different specifics on certain medications. Specifically for African American population, we know that they have less sensitivity for pain relieving, meaning they need more of a pain medication. They have increased risk of developing GI adverse effects. What are GI adverse effects? Cause GI bleeding, GI ulceration. Increased doses may be needed to achieve pain blocking effects, so it means they need more medication. and teach to use non-drug measures to decrease pain, such as poisoning. We just want to make sure that patient is using only what is being told to our patient, so we are not causing any excessive over toxicity of these medications. So we tell them also to make sure that they're not doing any other medications with these medications. So we want to make sure that we are so they can avoid those GI bleeding, dark tarry stool. All right, and then we can help them with other, sometimes if someone has very high fever, we can just say, okay, why don't you do cold compress instead of taking medication. Excessive pain, sometimes positioning might be helpful. Physical therapy might be helpful. And then warm soaks, environmental control. Okay, salicylates. Now, examples of medications or salicylates have anti-inflammatory properties. They can block the inflammatory responses, have antipyretic properties such as fever blocking, and have allergic properties such as pain blocking. Action and indications. They inhibit the synthesis of prostaglandins and used to treat mild to moderate pain and fever. So know that those prostaglandins, we were talking in that inflammatory cycle before, salicylates, they block that cycle. Pharmacokinetics, they're absorbed from the stomach and peak in 5 to 30 minutes and metabolized in all. Remember, all medications are metabolized in liver and excreted in the urine. That's just specific. That's just general for all medications. We never want to give our medications to a patient who is allergic to it. So we will ask them, hey, before giving any medication to your patient, always check, are you allergic to this medication? Have you ever taken it? Yes or no? Then your question will be, what is your liver function test? What is your kidney function test? Now, if not done before, I would want to ask doctor to order one. Okay, then adverse effects. Adverse effects could be effects on stomach or clotting systems. Drug-to-drug interactions interact with other drugs by interfering with absorption. Low doses. Low doses used as antiplatelet aspirin 81 milligram, inhibiting platelet aggression. And we want to be preventive. We want to make sure that whenever we're giving medications, we are teaching our patients about, oh, this medication is an antiplatelet medication. It could cause severe bleeding. Make sure that you are monitoring for any signs of GI bleed, or if you see blood in urine or blood in bleeding gums or blood in poop, you're supposed to inform your physician about it, because that's a side effect of this medication. So we're talking about aspirin right now. Aspirin could be given for, now before people used to think, oh, it's for pain, no, it's for headaches, but not necessarily. It's more so strongly an antiplatelet medication, which basically means that it will cause, it has very strong antiplatelet effects. It is an anti-inflammatory medication also. It could cause, what are the side effects? It could cause nausea. Nausea, vomiting is GI upset, is with mostly all medications, but these medications could cause GI bleed, heartburn, epigastric discomfort. They could cause alkali blood loss, dizziness, tinnitus, and acidosis. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs provide strong anti-inflammatory analgesic effects sold over the counter, which may lead to abuse. So meaning, like, if some medications are freely available, people might not know, oh, this might cause side effects. They just keep on taking it, and the next thing you know is they're having problems. So we just want to make sure that we are informing, educating our patients, and telling them what could cause, what could happen. And then that's why we have a pharmacist or a nurse or a physician who can explain the side effects to our patients. Okay, chronic use of non-steroidal anti-inflammatory medications can lead to GI bleeding. Anti-inflammatory analgesics and antipyretic effects. Contraindication and cautions. Allergies to any NSAIDs or salicylates and celecoxib is also contraindicated in presence of allergies to sulfonamides, cardiovascular dysfunction or hypertension, peptic ulcer, GI bleeding, pregnancy, lactation, renal and hepatic dysfunction. NSAIDs. There's another one, ibuprofen or Aleve. It is, why do we give it? We take it for pain. It's a pain medication, right? Sometimes we have a headache, I'll just take an ibuprofen or Aleve. For rheumatoid arthritis, for arthritis, mild to moderate relief of pain. pain fever reduction for fever, like okay, someone has fever, you take an Advil, mild fever. Adverse effects could be headaches, dizziness, tiredness, rash. If a person has rashes, that means patient's allergic to it. We never give it. So allergic responses could be part of side effects or adverse effects. We want to make sure that they are not developing any rash, hives, shortness of breath, difficulty breathing. If that happens, patient is allergic to that medication. We never give those medications to our patient, and we mark it as an allergy. Then we want to make sure a patient's not having GI problems. Now, NSAIDs are really bad for GI system. They could cause dyspepsia, bleeding, constipation, and GI bleeding is a very common thing related with NSAIDs. Okay, what are NSAIDs? Non-steroidal anti-inflammatory drugs, right? Okay, acetaminophen is another one. Another name is Tylenol. Tylenol is, why do we give it as a pain reliever? Someone has fever, okay, take a Tylenol. A very commonly used medication. How many milligrams for adult? 650 milligrams for adult patients, and just for one time. And we tell them not to exceed 4 grams a day, depending on what is their liver function. Now, this medication could cause severe liver disorders, so we always check baseline liver function before we give this medication to our patient. It could be given for pain, arthritis pain. It's a pain reliever and it's a fever reducer. Contraindication if a person is allergic to it, if a person is pregnant or lactating, or hepatic liver dysfunction related with alcoholism, that's something we have to take into consideration. That's a no. We don't give it to those patients. Adverse effects: headache, hemolytic anemia, renal dysfunction, skin rash and fever. Hepatotoxicity, it could cause liver toxicity. So we want to make sure that patient's liver is okay before we start giving these medications. Liver function test. Drug-to-drug interactions, oral anticoagulants increases bleeding. Hepatotoxicity with barbiturates, carbamazepine, hydantoins, and rifampicin. And that's pretty much it from this lecture. So that was just pretty much review of your anti-inflammatory cascade. So like, what are the cycles which are activated when a person get infections, and also the 2 medications which were mentioned in this area were salicylates, aspirin, and then the second one was Tylenol. Those are just 2 medications mentioned in this. Okay, so that's pretty much it with this one. This is for anti-inflammatory medications. Do your worksheet and submit them. Thank you for listening.